Welcome back. In case you're just joining us, we're here with Isaack, wahome, a clinical audiologist specialized at checking hearing for you, your newborns, and also offering solutions that are available. And it's an amazing session because we are learning that it is a very easily accessible process that takes just a few minutes to do, even for you as an adult. But the most important thing is to say that these things happen, but how do you live with it? How do you avoid it from happening? What information can you have so that you're able to also educate yourself and be at peace, and also be at peace with those who are around you who are suffering from the same issue? And oh my goodness, I'm very, very, very happy. Yeah. Very happy to also learn. I say here on the Nest, not only do we teach, especially the young people who have, thirst to absorb information, but we also create and give hope using true stories and real people such as yourself. You see these issues every single day. Right. Yeah. So just before we took a break, I had asked, and this is out of my own personal perspective, because I've not heard you use the term deafness. Yes. Could you just elaborate for us shortly about hearing loss and how it looks like and what you mean by being deaf?
Yeah.
Yes.
So basically, in essence, what we talk about as audiologists and the categorization we use is so that people can understand globally. If you are given that term, they can understand at what level you are at. So we have different levels of hearing. So, and we have from normal hearing, and from normal hearing there's a number. There's a figure that we use from negative 20 to 20. And then from that we have different levels of now hearing loss. And the higher the numbers, the more you have lost your hearing.
Yes.
So from 20 now, we start categorizing hearing loss as either mild hearing loss, and mild hearing loss are basically you are able to hear properly except soft sounds. And if you're in a classroom setting with people who have normal hearing, you lose up to 25% of whatever the teacher is saying.
Oh, yeah.
And then the next category is moderate hearing loss. So moderate hearing loss, now you not only hear soft sounds, but again, people have to repeat words that they're saying, and with a little bit of increased voice or loudness. So that is for mild. So you lose conversation up to 50% in a classroom setting.
Right.
And then the next category is severe. Severe hearing loss, you have now to shout. And you lose up to 75% in a classroom setting.
Yes.
So you have to shout, you have to look at somebody and lip read. And in most children, they start developing hearing loss and compensating their hearing problem between mild and moderate. What they do is they usually use a lot of visual cueing. So they lip read you and look at your face. And you can't tell between whether a child is really hearing or not.
Yes.
Until when you go to the next room, you call them and they can't hear, they're not aware about the environmental sounds. So this category of hearing that I've talked about, we usually say it's a hearing loss, and the terminology that they use is hard of hearing, so sometimes up to severe.
Yes.
And then from there, when you're profoundly deaf, so this is a hearing loss that is starting from 90 decibels. 90 decibels is like the siren of an ambulance. So if you can't be able to hear that siren of an ambulance, so you're sort of hearing it as muffled, as very faint, and it's just close to your ear.
Right.
So that is 90 decibels. So these are profoundly deaf from that level.
Right.
And when you're profoundly deaf, you're only aware of large or loud environmental sounds, like sirens, engine of aircraft, and vibration of motorbikes and cars. So those loud sounds are the ones that you can be able to perceive.
Right.
So these are the ones that we usually call deaf or profoundly deaf. Now there's another terminology that comes in, and you have heard people misusing or using the words dumb or those kind of
Yes,
words.
yes.
Now, when you're profoundly deaf or you are born profoundly deaf, there is very little chance of developing normal speech
I see.
or spoken language.
Right.
And you tend to have both things coming in at the same time. So you have a problem with speech and because of your poor hearing. So that is the commonest word that we use.
Right.
And there are various causes that can cause you to become profoundly deaf. And the easiest way we can break this to know, because people with profound hearing loss, they tend to be affected more in the nerve.
Right.
So what we call sensorineural type of hearing loss.
Yes.
Remember when I talked about the anatomical arrangement,
yes.
the outer ear,
Yes.
the middle ear,
Yes.
and the inner ear.
Yes.
So mostly the hearing with the problem with profoundly deaf people starts from the cochlear level.
Aha, the innermost
the inner
part
part,
of the ear.
cochlea and the nerve.
Yes.
So those are the people who basically we say they're deaf or profoundly deaf. I
Okay.
think that is the easiest way we can talk about
Wonderful.
that.
I love that. And it's
Yeah.
good to know that not everybody who has
Yes.
hearing loss
Is
should be
profoundly-
referred
Yes.
to as deaf.
Yes.
And there are different categories of
Yes,
that.
yes.
And talking of which, from the movies,
Yes.
from maybe people we watch
Yes.
all over, we have seen that there are actual interventions.
Yes.
Could you walk us through the interventions,
Perfect.
especially from newborn to adulthood? Yeah.
Yeah, for newborn, and the interventions are either depending on usually there are 3 types of hearing loss.
Yes.
So one we call it conductive hearing loss, and conductive hearing loss is a mechanical obstruction of the outer ear.
Yes.
For instance, people who are missing the outer ear that we are talking about, so they will have a conductive problem. For newborns who have wax build up inside their canal or vernix, or middle ear, there is infection and there is fluid.
Yes.
So that mechanism, if it is interfered, then sound will not be transmitted properly.
Okay. Isaac, could you walk us through interventions
Yeah.
from newborn
Yeah.
to adulthood?
Yeah.
Yes.
So the intervention that we talk about is, again, you have to look at the anatomical structure. It's the easiest way you can understand.
Yes.
One of them, you look at the outer ear, the middle ear, or the inner ear, where problem has taken place.
Yes.
So the outer ear, if there's no transmission of sound from a mechanical obstruction with wax, a missing pinna,
Yes.
or build up of fluid in the middle ear,
Yes.
then that can cause hearing loss.
Okay.
An intervention is as simple as either medication or surgical procedure.
Okay.
So surgical, what they do is they can repair the outer ear
Okay.
where it's missing.
Yes.
Or sometimes you have had some tubes or grommet insertion in the middle ear so that they can drain fluid.
Oh, I see.
Yes,
Okay.
yes. And we have seen even children or parents who say, oh, my child was done a surgical procedure. I hoped that it could have restored the hearing, but nothing happened. It could be just a grommet insertion
Right.
where probably the middle ear was not aerating properly.
Okay.
And then from there, we have now the inner part, which is caused either by the cochlear part, and the cochlear part is usually, the easiest way to understand is usually divided into 2 sections. We have some outer hair cells and inner hair cells. They're really minute, tiny hair cells inside there. The outer ones, basically they amplify sounds so that the inner ear picks sounds and they
Right.
take them inside.
Yes.
So in terms of intervention, when you have a problem with amplification of sound, then you put a hearing aid.
Okay.
So the hearing aid takes the role of the inner ear in terms of amplification.
Okay.
So when you lose that natural ability to amplify sounds,
Yes.
the hearing aid will help you now amplify external sounds as it directs towards the ear canal
Okay.
and to the cochlea. And then the other intervention is usually what we call a cochlear implant.
Yes.
So where you go now directly to the cochlea by putting some electrodes such that they collect sounds from an external device,
Right.
what we call a sound processor,
Yes.
to the electrodes,
Yes.
and direct to the auditory nerve, the
Right.
nerve that transmits sounds to the brain.
Yes.
So the interventions, number one, can either be medical, where you are using medicine to treat ear infections, and infections are preventable.
Yes.
Common infections like ear drainage and so on, or flu or cold, or these
True.
things like
True.
those ones.
True.
And then we have surgical intervention, where you are either repairing the eardrum that is perforated. A newborn, most of the time, it's a build-up of fluid, so you put a grommet insertion.
Okay.
Or newborn who are born with a missing a pinna, so they are done a surgical procedure to repair that and correct that.
Okay.
So that is basically like the surgical part.
Right.
Or the surgical part where you are going to do a cochlear implantation, which is a more specialized device, but works almost equivalent to a hearing aid. That's what
Right.
I'll basically. It's more technical than that.
Okay.
But for the general people to understand, that is probably how it works, by amplifying
Right.
sounds and
Yes.
taking it directly to the auditory nerve.
Okay.
So the interventions are in that broad category, and it depends with where exactly the problem is in the newborn.
Of course.
Yes, yes.
Yeah. So for the hearing aid and
Yes.
the cochlear implant,
Yes.
does the restoration take place 100% or is just to improve?
Okay.
Yes.
That question I get a lot, because people think that when I put a hearing aid, we have resolved that problem.
Right.
Now, this is a rehabilitative process. And when we put a hearing aid, and we start putting hearing aid as early as 6 months, 6 months of
Yes.
age.
Yes.
It's a really early age. So you don't have to wait.
Yes.
There are hearing aids that we put as early as 3 months of age.
Oh.
So what hearing aid does in a very simplified form, it is to amplify sounds. I usually explain to mothers or parents using a glass of water.
Right.
So when I have a glass of water which is half full
Yes.
and it has fluid,
Yes.
if I put, for example, a stone here,
Yes.
what will happen is that the water will rise up.
Sure.
So the stone is acting like the hearing aid. So what there's residual hearing that you have.
Okay.
So the hearing aid is
Yes.
going to amplify sounds based with whatever you still have in the ear.
Okay.
So if you're profoundly deaf, it means there's nothing to
Nothing,
amplify.
exactly.
So you definitely need a cochlear implant.
Yes, yes.
But if there's residual hearing, up to severe hearing loss, sometimes profound, and we can be able to amplify,
Right.
then we are increasing amplification of
Yes,
sound,
yes.
so that you are more sensitive and aware of
Yes,
sound.
of the
as
sounds
it
around
goes,
you.
Yeah,
Yes.
as
Yes.
it goes into the brain.
Yes.
Yes.
And the cochlear implant, does it do 100%?
So it does. You know, this is treatment. If you have lost hearing loss, you are way down there. But when you put, for example, a hearing aid, we are restoring, we are trying to restore your hearing to a normal hearing.
Yes, yes.
All right?
Yes.
However, it will require other additional interventions. So cochlear implants goes hand in hand with verbal stimulation with a speech therapist, and then mapping with an audiologist.
Yes.
Consecutively, and of course a neurologist will review you, and then an ENT will always review you, and that sums up the cost of cochlear implants. When I put hearing aid on you, I will have to follow you up, make sure that I have optimized sound,
Yes.
because it's not a one-time event.
Right.
It's not a hearing aid that you probably
Works
buy from the
constantly,
shop and
yes.
put and it works perfectly.
Right, yes.
We have to customize
Yes,
it,
yes.
and we have to optimize, because the environment, the sounds in the environments are so dynamic,
Yes,
and
yes.
they change.
Yes.
Today you're working here in a quiet place, the next day you're working at
That's
a
true.
warehouse,
Yes,
or you're
yes.
working in a noisy environment.
Yes.
I have to optimize that hearing aid. The technology in hearing aid has really improved. Now they're using a lot of artificial intelligence.
Right.
So what artificial intelligence does is that you come in a room, it scans the environment, and is able to tell how much amplification is needed based on that environment.
True.
So if it's a quiet place, it's able to tell. If it's a
Okay.
noisy place, it's able to tell. So that is where the technology is going, to optimize sounds based on an environment that you are in.
Right.
Because they keep on changing.
True.
Now you are okay in a quiet place. The next day you're going towards your car, you're in a traffic area, and
yes,
so on.
yes.
Now for newborn, because we are very specific to newborn, number one, we start by hearing evaluation and testing, and then we start the process of rehabilitation. And rehabilitation could be either medications we have talked about, or surgical procedure,
yes.
or a hearing aid.
Yes.
And then that hearing aid, I have to do follow-up. I have to
Yes.
optimize and make
Yes.
sure that you are getting enough adequate sounds.
Okay.
So it's actually a process.
Ah.
And I have to, again, to involve a speech therapist who comes in
Yes,
and
yes,
introduce verbal stimulation
Yes, yes,
to a
yes.
newborn or
Yes,
a child,
yes.
so that they can actually know that sound I'm hearing, I'm supposed to absorb it
Yes,
and
send
give it back.
Exactly.
Yes,
Okay.
yes.
Wow.
Yeah.
Give hope to any parent
Yes.
who has just gotten the news
Yes.
the child
Yes.
has hearing loss.
Yes.
Give them hope
Yes.
in terms of intervention, which
Yes.
we've already spoken about,
Yes.
to a full productive life,
Perfect.
maybe with examples as
Yeah,
well.
yeah.
Yes.
So what I tell my parents is, because I get that concern a lot, they start asking whose fault it is. Is it the mother's fault? Is it the father's fault? They start looking at backgrounds. Is it witchcraft? Is it alcohol? Is it those? Is it medication? Did you not take
Yes.
care of yourself
Yes.
properly?
Yes.
So point number one is that it is nobody's fault. It's just that God has given you an opportunity to raise a child in a different way.
Yeah.
And it's a challenge, and it's a difficult challenge that that requires the support of a family at large, both parents, nuclear parents, and even the community, such that you are not supposed to stigmatize
Right.
these people.
Yes.
I have seen successful people, and I like giving an example to parents. They go and watch live people who have recorded themselves, like in YouTube. There's one that is called Mark. It's called Mark's Journey. So Mark started with being profoundly deaf, and was taken early intervention in a school, and then was fitted a cochlear implant early. And Mark has become a neurologist or a doctor with normal speech, but through very difficult steps, of
Yes,
course, with
yes.
parents who are understanding, and they took initiative early.
Yes.
I have a good friend who is a professor and is deaf, very well doing,
Wow.
and is teaching more deaf people and
Right.
advocating the same.
Yes.
So I have two categories of people. Those who did early intervention, especially with profoundly deaf, with a cochlear implant.
Right.
In my journey, I have seen children who came with severe hearing loss, moderate hearing loss, with no speech. They have been seen by, we have fitted hearing aid, we have referred them to speech therapists, and they have developed normal speech, and they have been integrated to normal school.
Right.
I've seen those who came late when no intervention has taken place, because what we say is that you have until 9 years of age. That is when there's a lot of plasticity
It's true. True.
with brain development,
yes.
and children can be able
Yes.
to play around
Yes.
and adjust a lot. Sometimes when you're too late, from 9 years of age, 10 years, I've seen those who are coming at 13 years of age and so on. The key is that take them to a school. The government of Kenya, from time immemorial, has specialized school for all children.
Yes.
They have integrated school. Integrated school are specialized schools where you have normal children, and then we have classrooms which are specialized with specialized teachers,
Yes.
and children with special needs like
Yes,
hearing loss.
yes.
So we have hearing impaired schools, and then we have deaf school. And deaf school, they learn like normal children,
Yes.
and they just do the same examinations
Yes.
as other children,
Yes, yes.
KCP or
Yes.
the neck examination and
Yes.
so on.
Yes.
And they, they progressively do well, and they work in institutions that are reputable. I have one of my colleague who is deaf, and we work together, and he works the same.
Yes.
He does the same. It's only that he can't be able to hear,
Yes.
but he's able to lip read
Yes.
and use the visual cue
Yes.
and do and have a family like any other. I've seen deaf people who have families, they grow up and have children who have normal hearing.
Yes.
Both of them are either deaf or one of them is deaf, and so on.
Yeah.
So I think these are people who are living in our community. And however much you might think they are few, or you might see yourself as you are the only one, there are so many other people. It's only that you have never interacted with them,
Yes.
or you have never met with them.
Absolutely.
Personally, I meet with these people every other day. So it looks like it's my normal world
Yes.
to meet people who are profoundly deaf,
Yeah.
or they're deaf,
Yeah.
or they have hearing loss.
Yes.
For you might be alone in the village,
yeah,
alone in
yeah.
the estate,
Yes.
or at home, and you think you're alone. There are so many of them, and most of them are doing very well.
That's wonderful.
Yes,
That's
yes,
wonderful.
yes.
And I think the more we put word out there,
Yes.
that it's a normal thing
Yes.
that can be has interventions.
Yes.
In as much as obviously at a part we didn't touch on, and we hope to have you again so we can touch on that.
Yes.
The cost of
Yes.
these
Yeah,
interventions.
yeah.
However, as an adult
Yes.
and as a parent,
Yes.
what are these practices even now
Yes.
that I can do
Yes.
that will prevent any kind of hearing loss? Because hearing loss can also come when you're an adult.
Yeah.
What are these things?
Preventable.
Yes.
So in 2017, what we call the World Health Assembly noticed is a trend in terms of unaddressed hearing loss, and the trend is increasing. And recently, the report that came out, it says that 1 billion young people are at risk of avoidable hearing loss, and the commonest being noise. Noise has become such a big issue
Yes.
that can cause hearing loss.
Yes.
Either recreational sound, noise.
Yes.
So we are talking about, going to clubs,
Yes.
matatus, commonly in Kenya,
Yes.
that are
Yes.
really loud, or
Yes.
cars that are
Yes.
loud.
Yes.
Earphones, prolonged use of earphones, with loud sounds and so on.
Right.
And even at home, you like music as an adult, but this is not good for your child when it's too high. Which is a common thing. And then,
Yes.
of course, we talk about infectious causes,
Yes.
ear infection, preventable infections, especially with immunization. So we are encouraging parents to make sure that their children are fully immunized. Conditions like measles and so on can easily cause hearing loss.
Yes.
Of course, trauma or injuries. For example, when we like riding motorcycles a lot, so you're riding a motorcycle without a headgear and so on, at high speeds and so on. This one can cause hearing loss.
Yes.
Medications, over-the-counter medications, you're just taking pills, medicines without knowing the consequences that they are going to cause you.
Yes.
You are receiving treatment from, it could be pneumonia, it could be meningitis.
Yes.
That treatment that you're getting can affect your newborn.
Yes.
People who basically they get things like cancers, even during pregnancy, they want to retain pregnancy, but they still have to get chemo or radiotherapy. You are at risk, both you and the newborn, to get hearing loss.
Yes.
So you need intervention. You need to see us, to monitor. You need us to test and see actually what we can do towards making sure that you have a normal hearing and so on.
Yes.
So I mean, like, the interventions are very many, but they are basic and fundamental. One of them, we talk about newborn screening in children. We talk about annual hearing screening for people who are living in occupations that are at risk.
Yes.
So before you get in unemployment, and after you get out of unemployment, you have a hearing check.
Yes.
For normal population, just going to your ENT doctor just to check inside your ears, because wax build up can cause hearing loss. You could be having hearing loss from other infectious causes that you're not aware about, that can be checked and treated. So those are basic things that you can do. And of course, things that you can avoid at home, like, the commonest is cleaning our ears with cotton buds.
I was hoping you'll say that. Yes.
Yeah.
Yeah.
That can cause trauma,
Yes.
can push wax inside their father. Those kind of practices that are, we say they are risky behaviors that can basically cause hearing loss.
Wonderful.
Yeah.
Quickly, could you tell people where they can find you?
Yeah, so you can find me at Dexter Hearing Center in Kimathi House, 5th floor. We are a team of audiologists and ENT specialists that are there, that we are able to do all this hearing evaluation at the occupational levels. We are talking about people who are working in the industries, people who are like pilots and so on, cooks, all those kind of individuals, people who have been referred by their physicians, they don't know where to come for a hearing test, or you have been done a hearing test and you don't know where to get your hearing aid, you can come at Dexter Hearing Center. Dexter, which means right.
Yes.
Yeah, right
Yes.
side.
Yes.
So it's at Kimathi House, at the CBD, at the heart of Nairobi.
Yes.
So it's easy to get us.
Yes.
And of course you can get us on our website,
Yes.
on Dexter, www. Dexterhearing.com.
Okay.
You can also get us on Facebook. You can also get us on Instagram. We are there.
Nice.
You can email us at info.dexterhearing.com. You can even call us on our mobile phones. We can share if you want.
Yes, yes, we will.
Or mobile phones, you can also call us.
Yes.
We can give you a consult.
Absolutely.
And our philosophy at Dexter is that if you have a hearing test that has been done, you can come for a free consultation. Because we want you to understand the journey.
Wonderful.
Yeah, you just come, we tell you this is the intervention that you need and so on.
Yes.
And of course, these other tests that can be done, we do a lot of tests for adults, pediatrics, and newborns.
Wonderful.
Yes, yes, yes.
Thank you so much, Isaac, for your time, for giving us a lot of wisdom.
Yeah.
We had a free consultation, and we hope to have you back so that we can, this topic is deep and wide, and we hope we can talk more about it.
I really appreciate the opportunity that we can come and talk to the community about their hearing concern, and more so with the newborn.
Wonderful.
Yeah, we need to take care of these small angels.
Yes.
We really do.
We do.
Yeah.
Wow, guys. As always, we've come to an end of an amazing, amazing session. Yes, you did have a free consultation. You've learned something about hearing loss, and you've learned that there's a huge difference between hearing loss, or how it's chronological. You know, it can come from the mildest to severe or profound, where you become a deaf or you're announced as deaf. Remember, there are interventions, and these interventions do help in making sure that you live a healthy, long and productive life. It also means that the earlier it's done, the better the chances are that someone is going to be just okay at the end of it all. I have learned a lot. If you have a similar story, something you'd like to share with our audience here at The Nest, please reach us out on our social media pages at Y254. I've been your host, Maureen Waititu, and until next time, have a good evening and see you.